Today on the Healthful Pursuit Podcast, the digestive dysfunction will kind of lead into the inflammatory dysbiosis because we have lowered stomach acid, we have lowered bile, we have digestive enzymes that then feed the inflammatory microbes or allow other things to enter because the digestive enzymes just aren't high enough. And this can all lead to constipation. Hello, my friend, and welcome to the Healthful Pursuit Podcast. In today's episode, I'm sharing an in-depth look at a one-on-one client session where we explore the root causes of her ongoing gut and health challenges. This conversation delves into the complex interplay between gut health, thyroid function, nutrient absorption, and inflammation. From understanding patterns of dysbiosis to tackling issues like constipation, dry skin, and metabolic imbalances, this episode offers actionable insight for anyone looking to take a deeper dive into their own health journey. Now, if you haven't listened to the episode that I did previously on the GI map from Diagnostic Solutions, definitely head on over. After you've listened to today's episode, head on over to episode 479 that was published June 25th of 2024, labeled Stool Testing, Diagnostic Solutions GI Map, because I talk about this test, why it's different from others, why I use it in my practice, why I do not use any other stool testing. I don't even want to look at the results because they just don't line up to how we're going to address the dysbiotic patterns. If a practitioner tells you that you have dysbiosis, I cannot even tell you how many naturopathic doctors told me, you have dysbiosis, take this antimicrobial. And my problem was not that I was lacking antimicrobials. My problem was that I had an insufficiency problem. Treating an insufficiency problem with antimicrobials is only going to make the insufficiency worse. And I got stuck in this cortisol dysregulation issue. And I see this all the time. So if you want to learn more about all this testing, listen in. You can be a fly on the wall in my clinic and just get a sense of what a Diagnostic Solutions test can provide you in understanding your health in a deeper level. Let's cut over to it. Hey, my name is Leanne, and I'm fascinated with helping women navigate how to eat, move, and care for their bodies. This has taken me on a journey from vegan, keto, high protein to everything in between. I'm a small town holistic nutritionist turned 3-time international bestselling author turned functional medicine practitioner, offering telemedicine services around the globe to women looking to better their health and stop second-guessing themselves. I'm here to teach you how to wade through the wellness noise to get to the good stuff that'll help you achieve your goals. Whether you're seeking relief from chronic ailments, striving for peak performance, or simply eager to live a more vibrant life, this podcast is your go-to resource for actionable advice and inspiration. Together, we'll uncover the interconnectedness of nutrition, movement, sleep, stress management, and mindset, empowering you to make informed choices that support your unique health journey. Think of it as quality time with your bestie mixed with a little med school so you're empowered at your next doctor visit. Get ready to be challenged and encouraged while you learn about your body and how to care for it healthfully. Join me as we embrace vitality, reclaim our innate potential, and discover what it truly means to pursue healthfulness. Hello, good afternoon. I'm so glad that we get a chance to go through everything here. So we have a lot of reports to go through. Let's just get down into it. So in the chat, I was talking about some of the key components, and hopefully I can paint this nice picture for you about what we can do like functionally. I remember when we were going through our initial session, some of the bigger issues had to do with immunity and constipation, digestive issues, metabolic dysfunction, and then super dry skin. And so because those are the biggest issues, I had that in the back of my mind as I was looking through all of these reports to kind of get a sense of the connections. Now, when it comes to the immunity piece, as well as the dry, cracking heels, calluses, those sorts of things, that could absolutely be tied to vitamin A. And one of the main reasons we wanted to do the SpectraCell was to understand the vitamin A component and the thyroid component, because the thyroid will also contribute to this. And both the selenium and vitamin A were low in the SpectraCell. And so that brings me to the suggestion to add both vitamin A and selenium. Now, with vitamin A, we would usually do for 6 months and then retest. And with the selenium, the same thing. Now, why I would suggest selenium on its own, especially when it comes to the thyroid, is if we look, let me bring this up because sometimes I do it by memory and then I say the wrong thing. When we look at the thyroid function, so right now, the thyroid is saying the pituitary is saying we need more thyroid hormones. So the TSH is elevated, but we can see that the free T4 is normal. And it's actually gotten progressively better since the last testing. So this is very, very good. But with the reverse T3, this is the hormone that says, yep, we have enough thyroid hormone. The thyroid is saying it has enough and it's converting enough and it doesn't want more. So you have the pituitary saying it wants more, but the thyroid saying we're good. And if you give me more, I'm just going to deactivate it. And so when it comes to gut function and nutrients, we have to be systematic in our approach. So if we just add more thyroid hormone to the mix, when we can see this balance, what's likely going to happen is the body's just going to deactivate the thyroid hormone. Okay. So when we see a free T3 that's low and a free T4 that's normal, we think selenium. And so then we go to the SpectraCell and we see that selenium is low. We think, okay, well, if we bring in selenium, it will increase the total T4, lower the TSH, increase the free T3 while keeping the reverse T3 regulated. And that's why I said it could be beneficial to bring in the selenium first, run through gut work, because the gut will influence the conversion of all of this. So the liver and the gut is where thyroid hormones convert. And so if the gut is not working properly, again, going back to the biggest issues that you came to me with, immunity, digestion, metabolic dysfunction, and dry skin. In the case of the digestion and working through the GI map, once we get the digestion to a better place and just the bacteria in the gut to a better place, that will also help the thyroid. Okay, so that in turn, when it comes to the thyroid, influences overall skin health, which can also help with the skin top priority issue. Now, also with the skin top priority issue and your concerns over liver function, the liver on the blood work looks far better, and we're going to continue to work through this. Red light on the liver can be really helpful. So just like sitting, watching a show or doing something while having the red light just shine on the liver can be really helpful. But overall, the liver enzymes looking far better. Vitamin A can also help these liver enzymes. Now, you might wonder the ancestral supplement that she's on. I wondered this too, like how much vitamin A will be in that. I looked it up. It's only like 150 IUs. We need about 5,000. So from a SpectraCell kind of like summary, we're going to add in the vitamin A, we're going to add in the selenium, and then there are about a bunch of nutrients that are just kind of borderline along with the selenium that I don't think we need to necessarily supplement with, but we can definitely emphasize in the diet, like the alpha lipoic acid. The choline we're going to add in directly only because choline will help with any mold issues, which we're going to talk about in a second. Cysteine, vitamin C, those sorts of things we can just add in the diet. And I'll add that to the protocol with outlines on how to incorporate some of the foods that have these nutrients. Let's talk about digestion. And if you're anything like me, you have struggled with digestive issues. BioCell Collagen could be the game changer that you need. Since I started taking it, not only has my hair, skin, and nails improved, but my digestion has also become so much better. I feel less bloated, more comfortable, and overall just like healthier. Do you know when your bowels are just on point, you just feel like a different human? BioCell Collagen is hydrolyzed, meaning it's easier for your body to absorb and put to work where it's needed most, including your gut. It supports the lining of your digestive tract, helping to improve nutrient absorption and overall gut health. Plus, it helps regulate secretory IgA, the gut soldiers of your gut. It's a simple and effective way to support your digestive system from the inside out. And if you're ready to support your digestive health and feel your best, you can go to mygrowinghair.com to get a month's supply of BioCell Collagen for $25 off. Plus, if you set up a subscription, you'll save an additional 25% off every future order forever. That's 15% savings every single month. And when you purchase through my site, I'm going to send you a personal text from my phone number so that we can stay connected on all things collagen, hair, digestion, nails, all things. Don't miss out by going to mygrowinghair.com. Again, that's mygrowinghair.com. Okay, the other big topic or big area, biggest issues that we wanted to tackle together is digestion and just lifelong constipation. So then opening up the GI map and kind of having that view, we want to understand that a GI map gives us an idea of the 3 different patterns of dysbiosis. So when a practitioner says you have dysbiosis in the gut, it's like, well, that's literally pointless. Like everybody does. We need to know what pattern of dysbiosis we have, because how we address each dysbiotic pattern is going to be so different across the board. Okay. So we have digestive dysfunction dysbiosis, inflammatory dysbiosis, and insufficiency dysbiosis. With digestive dysfunction, what's happening is that we're literally dysfunctional in our digestion. So we're usually going to see lowered digestive enzymes. We're going to see lowered hydrochloric acid. We're going to have symptoms usually immediately after eating, like gas, bloating, abdominal discomfort, fullness after eating, GERD, constipation, diarrhea, SIBO, food sensitivities, intolerances. And so we have a little bit of that going on in the GI map. We also have a little bit of inflammatory dysbiosis. These two can kind of occur together, where we have an inflammatory situation that has occurred because of the digestive dysfunction, and then over time continues to morph into a further and further and further inflammatory dysbiotic state. So these symptoms with inflammatory dysbiosis start usually hours after eating. So you eat, you feel fine, and then a couple of hours later, you're dealing with bloating, gas, constipation. And so it can be a little bit difficult to kind of unpack, because you have the immediate onset with the digestive dysfunction and then ongoing symptoms that pop up 2 to 3 hours after meals. And this can also lead to constipation, diarrhea, hair loss, poor nail growth, like longer term issues, brain fog, fatigue, autoimmunity. And so, like I said, the digestive dysfunction will kind of lead into the inflammatory dysbiosis, because we have lowered stomach acid, we have lowered bile, we have digestive enzymes that then feed the inflammatory microbes or allow other things to enter, because the digestive enzymes just aren't high enough. And this can all lead to constipation. Then we have the third dysbiosis, and why I'm introducing you to all these things is that we kind of have like a mixture of all of these 3 in the GI map. So with insufficiency dysbiosis, this is going to affect the immune function of the body and the intestinal integrity of the body. Oftentimes, there will be a progression of this over time, of like as we go on antibiotics and as we're just like not eating the right things and we have more inflammation, it gets more and more and more progressed. So this is basically a dysbiotic pattern where we are lacking in healthy bacteria, and this healthy bacteria protect against infections. They moderate intestinal permeability. That's why zonulin, which we can see in the report, is out of whack. And so which came first, the chicken or the egg? It's sort of like challenging to know. Usually how I've seen things progress is an individual will usually start with an insufficiency and then move to digestive dysfunction and then get more inflammatory bacteria as we go. Or sometimes it'll start with the digestive dysfunction, morph into inflammation, and because their digestive function is so low, it will start leading to an insufficiency. So that's kind of a basic introduction to how to understand the GI map. Now, understanding that, we can go through the results and really understand and start to pinpoint symptoms, our biggest issues, and how we're going to correct. Okay, so page 1 of the GI map, we don't need to worry about. Everything is DL there. If you remember the digestive dysfunction, H. pylori is kind of the marker that we would use for digestive dysfunction to know whether or not there's a digestive dysfunction. So we can see there the H. pylori is present. So the presence of H. pylori is enough to say that there's digestive dysfunction. But going a little bit further onto page 3, we can see the staphylococcus is elevated. That will be elevated in cases of digestive dysfunction, as will bacillus and enterococcus, sometimes even streptococcus, which we don't see on yours, but can be elevated throughout that. So that's kind of like confirmation there's digestive dysfunction, then you will probably want to understand, well, do we need to bring in enzymes or do we need to support the liver? The cool thing is for on page 4, the steatocrit looks normal, like it's DL. I'm really happy with that from a liver function perspective. Tells me that likely bile production and bile function is not the area that we need to focus on. It's more just hepatic support overall. But with the elastase, we see that you can see it's kind of like almost to the yellow. Why this doesn't show lower than it should in a digestive dysfunction pattern like this is because the commensal are low. So the commensal, if you look back to page 2, kind of like drag your eyes through it and you're going to see more of the arrows kind of on the left side or massively left side. So this is a slight insufficiency, meaning that we don't have enough of the beneficial bacteria that then helps to break down the elastase. So the elastase is actually going to look normal when it's likely not. And so 9 times out of 10, when we're dealing with digestive dysfunction, the main reason why this is occurring is because we don't have enough digestive enzymes. So it's going to be key in the first part of our insufficiency protocol, which is what we're going to start with, that we really, really support digestive dysfunction with enzymes. So you're going to see enzymes, probiotics geared toward these specific bacteria to help regulate the gut. So that's kind of a combination of the digestive dysfunction and the insufficiency that we're seeing in the GI map. How we know that there is inflammatory dysbiosis is if you go to page 3 and you look under the inflammatory and autoimmune related bacteria, we see Citrobacter being elevated. So Citrobacter is a yucky bacteria that is going to cause secretory IgA to elevate substantially. So if you go on that last page, of course, you're going to see the secretory IgA is quite elevated. This is a high priority bacteria. It tells us whether or not there is inflammatory action in the gut, which is going to drive up other bacteria that shouldn't necessarily be elevated, but they're in response to the inflammation that the Citrobacter is causing. Now, in some cases, the Citrobacter can even cause joint pain. So previously I was saying that the secretory IgA is going to be elevated. Why that's a concern is when the secretory IgA, which are the gut soldiers of your gut, the primary immunoglobulin in the intestinal mucosa, they're really that first line defense against basically everything. And so when they're elevated, it's like there's a war going on in the gut. Everyone's got their equipment on, they're ready to go, the body's protecting itself, usually due to a chronic situation. What will oftentimes happen over time is that the body will just get absolutely depleted. And so we have to get that Citrobacter down so that the secretory IgA little gut soldiers can go down and other bacteria that are increased in response to inflammation, like the Bacteroidetes is lowered because of the inflammation. What else? The Faecalibacterium will help with inflammation and is lowered due to the inflammations. We got to get that up. High Enterococcus is elevated because of the inflammation. So everything's kind of being driven by this inflammation. In addition to the beta-glucuronidase, which is only going to reactivate estrogen and then cause issues. So we need to be systematic in our approach, because if we just went in and started killing the Citrobacter, she's going to respond poorly. And so we want to first go after the insufficiency, then fold in some digestive dysfunction and inflammatory, and finish off with just a tiny bit of digestive dysfunction and inflammatory as we kind of like see how the body responds, pulling away those supports. Attention health enthusiasts, Paleo Valley just dropped the hottest new flavor of their 100% grass-fed bone broth protein, introducing salted caramel. Packed with 15 grams of collagen-rich protein per serving, this clean, nutrient-dense powder is made from grass-fed, pasture-raised beef bones, no grains, no pesticides, and no harsh chemicals. Why Paleo Valley? Unlike other brands that source collagen from hides, Paleo Valley's protein comes from bones, unlocking a treasure trove of amino acids to help improve gut health, digestion, and metabolism. And the flavor, decadent salted caramel that blends beautifully in coffee, smoothies, or even baked goods. Your taste buds will thank you, but don't take my word for it. Thousands of 5-star reviews rave about improved digestion and sustained energy throughout the day. Here's the deal. Go to paleovalley.com/Leanne to get 15% off your order today. Plus, every order is backed by a 60-day, 100% money-back guarantee. Don't wait. Visit paleovalley.com/Leanne now and start enjoying better digestion and lasting energy. Okay, wrapping this all up, hopefully with a pretty little bow, is the blood work overall. Now, if we look at the blood work comparing both February and October results, much better. Like across the board, there are a lot of positive changes. Like if we just look at the RBC panels and the variations of the sizes of the RBC and nutrient status overall, it looks far, far better, like really good. I'm very curious to see, after addressing the digestive dysfunction, dysbiosis, and the inflammatory and insufficiency, and we get her on HCl when the time is right, what will happen to the M markers? Because right now they're quite elevated. The MCV, MCH is elevated. The MCHC has regulated itself really nicely, but these two being elevated, when we've done the SpectraCell nutrient panel and it's come back with your B12 and folate being normal, that's like awesome. We know that these M markers aren't being driven up by a B9 or B12 need. It could be a vitamin C need. So in the protocol, I'm going to outline a bunch of different vitamin C foods. If we feel like there's space in the protocol, we can definitely add vitamin C, but we'll just kind of like see where we end up. I'm just going to make a note and kind of see. I just don't want to bog you down, or supplements. And we'll just kind of see where we end up with that. Get it? C, vitamin C. Okay, so immune function, everything looking really good there in the white blood cell panel. We talked about the insulin and just the regulation there. This is probably just a situational thing where when there's treats, they're eaten, and we just got to regulate that a little bit better. You're doing all the right things with the movement and the walking and everything. What other pieces? Oh, I did want to mention there's a slight dehydration pattern. It could have been like a couple days before the testing. We didn't hydrate well enough. It's just ever so slight. So I just wanted to mention it. Liver pattern, like I mentioned in the last audio, is looking far better. The triglycerides. So the triglycerides could be low due to the digestive dysfunction. If after we address this, the triglycerides are still low, it could be feeding into a mold pattern. My plan kind of with the mold is have this to kind of like run in the background as we address the digestive components, because mold will affect our gut. We know that there could be a mold issue in the home. We know that there are mycotoxin symptoms. So just logically, it would make sense to address the gut, see how everything responds. If the body is responding positively to protocols, then it's usually that the mold isn't bad enough or isn't conquerable in the current situation, and we can do a lot of work, but we'll keep a pulse on this triglycerides, understanding that even throughout the digestive components that we're working on, throughout the GI map and the protocols to follow, that we're going to kind of have mold in the back of our minds. Like, for example, we're going to increase the PC, which will work to address some of the mold in the background. We're going to keep on a mold binder that also works on the GI, so we can kind of cross out all the things at the same time. And if we feel like we need to do an actual mold protocol after the next 3 GI protocols, we will, but we may not need to, and we'll just test blood work after that and see. Thyroid we already talked about. Vitamin D is looking good. All that looking great. Inflammation, far better than it was last time. The homocysteine is looking good, so that's your B12 folate regulation as well. So that's the blood work. I hope you enjoyed our time today. You were a fly on the wall in my clinic. If you want to learn more about how to use the Diagnostic Solutions test, you can head on over to episode 479. It's labeled Stool Testing Diagnostic Solutions GI Map. It's the only stool testing I use in my practice. Clients will give me stool testing that other practitioners have used, and I have not found them to be helpful or clarify much of anything. So if you want to work with somebody on this, you can head on over to healthfulpursuit.com/shop/coaching. I'll have details in the show notes. If you want to learn more about how to work with me, I will be accepting a couple of clients in 2025. And so it's good to get on that wait list and kind of get a sense of how my next year is going to go. So I hope you enjoyed today's episode, and I will be back for another one next Tuesday. Okay, bye. Thanks for listening to the Healthful Pursuit Podcast. Join us next Tuesday for another episode of the show. If you're looking for free resources, there are a couple of places you can go. The first to my blog, healthfulpursuit.com, where you're going to find loads of recipes. The second is a free parasite protocol that I've put together for you that outlines symptoms, testing, and resources to determine whether or not you have a parasite, plus a full protocol to follow to eradicate them from your life if you need to. That's available at healthfulpursuit.com/parasites. And last but certainly not least, a full list of blood work markers to ask your doctor for so that you can get a full picture of your health. You can grab that free resource by going to healthfulpursuit.com/labs. The Healthful Pursuit Podcast, including show notes and links, provides information in respect to healthy living, recipes, nutrition, and diet, and is intended for informational purposes only. The information provided is not a substitute for medical advice, diagnosis, or treatment, nor is it to be construed as such. We cannot guarantee that the information provided on the Healthful Pursuit Podcast reflects the most up-to-date medical research. Information is provided without any representation or warranties of any kind. Please consult a qualified health practitioner with any questions you may have regarding your health and nutrition program.